Welcome back. Thanks for joining me on this discussion of colon cancer under the section of large intestines. What are the causes of colon cancer? I'll give you a second to think about this. Here are some very important colon cancer risk factors. Low fiber, high fat diet. We call this the Western diet. There are very important hereditary syndromes to be aware of. Gene mutations from a polyp all the way to cancer in a predictable fashion. And inflammatory bowel disease, including ulcerative colitis and Crohn's disease. Ulcerative colitis and Crohn's disease will be covered in your medicine lectures. Let's start with one of the very important syndromes, hereditary non-polyposis colorectal cancer, HNPCC. HNPCC are typically described as either Lynch syndrome 1 or Lynch syndrome 2. Lynch syndrome 1 is an autosomal dominant phenotype and classically associated with a DNA mismatch repair gene, MLH or MSH. On your examination, when presented with a particular DNA mismatch repair gene, look for these as the answers. In Lynch syndrome 2, it's similar to an autosomal dominant Lynch syndrome 1, except that now you have extracolonic cancers, particularly endometrial or ovarian. Peutz-Jeghers, another important syndrome, autosomal dominant phenotype. These are classically associated with hemartomas, which are benign in the GI tract. Also associated with mucocutaneous pigmentation. However, although the hemartomas are benign, there is an increased risk of associated GI cancers, not derivatives of the hemartomas. How about familial adenomatous polyposis? These are multiple colon polyps and usually in the thousands. There is a APC or adenomatous polyposis coli gene, which is a tumor suppressant gene mutation. And as a reminder, in general, when a tumor suppressant gene mutation occurs, there's no tumor suppression. Just like many of the other polyposis syndromes, this is also autosomal dominant in nature. Typically, you'll find hundreds or thousands of polyps, and there's almost 100% guaranteed of risk of colon cancer due to the pure volume of polyps. Shortly, we'll discuss the very predictable line of polyp to colon cancer and why often FAP patients will require surgery. Gardner syndrome, another high-yield syndrome, again associated with colon polyposis. This is considered a subset of familiar adenomatous polyposis that we just talked about. And the difference here is that it's a multiple polyposis syndrome that's associated with extracolonic manifestations, such as desmoid tumors, sebaceous cysts, lipomas, and osteomas. When you're presented with a clinical scenario that shows extracolonic manifestations as well as polyposis, remember Gardner syndrome.